Welcome to Drug Advocacy Radio. Remember, you're not being asked to judge. We thank you for joining us in our commitment to addressing and ending the war on drugs via education and public conversation. From the chemical to the cultural, you're listening to Drug Advocacy Radio.
Hello, and welcome. Today we will be talking about and reviewing John Oliver's most recent episode of Last Week Tonight, in which he discusses psychedelic therapy. And we'll also discuss his episode from 10 months ago, which is on harm reduction. So I have been a fan of John Oliver and his work for a really long time. When he came from The Daily Show, I loved how he repeatedly exposed me to issues that I had no idea even existed. Like, he has an episode about chickens, poultry farming, and FIFA being corrupt, I learned about through him. He's also changed my views on a lot of things. He made me rethink the death penalty, and he's made me really depressed a lot also, especially when he talks about usually the environment or police brutality, of course. I also considered it an honor when John graced my next-door neighbors from growing up with calling our local sewage plant of Danbury, Connecticut, the John Oliver sewage plant has now been renamed to be named after him. So I really do love John, and I think that his comedy is also usually impeccable. It's very fast-paced, but it's witty, it's well-timed. He has this like nerdy, excited British dad twist that's often like innocently pervy and often very well researched until tonight. And that brings us to what I'm here to talk about now, which is his episode from last week on psychedelic therapy. And there were a lot of pros to his overall defense. You know, he acknowledged Indigenous history right off the bat. He had a great joke about R. Gordon Wasson being the first white man to ever make mushrooms his whole personality. That was great. He said that, you know, music is the way it is because of drugs. And he really specified that this episode was about psychedelic therapy, and which is just one of its many uses. And so I'm going to focus this episode on talking about more of my critiques and places I think that John could have improved on, because I'm sure there's already going to be lots of other people covering the things that they think he did well in. And I do encourage you to watch it for yourself also, and if you haven't already, to see what you think. But I do really like that he did acknowledge and positively portray also, he came out of the closet about using weed and like loving, he called himself like majoring in ganja economics or something in college. And so you know, on this station here, we're very much advocates of all professionals or people with the ability to come out of the closet about their drug use, and John Oliver did just that right off the bat in this episode. He also positively portrays acid. He even had this episode or clip of a reporter inadvertently inhaling massive amounts of smoke from a burning hashish field, I think. And John says something about how like cute the reporter is or something. So John overall is not here to shame drugs. He calls himself, you know, a cool guy or a cool dad pretty much in one of the early bits of the show. But there are a lot of things which he is unfortunately very daft on and hasn't really gotten the full picture of, and definitely needs to grow his understanding in. And the very first one off the bat is his use of meth as a punchline and heroin use and users as a punchline. He refers to a study from 2002 where the researchers gave the participant monkeys extremely high doses of methamphetamine, but they thought and published findings saying that it was MDMA before retracting it, before later retracting it and saying that they had actually given the monkeys methamphetamine, and that the results that showed all this damage to the dopamine system, and 2 of them died or something, they said that that was actually because of meth. So that study did happen, and these monkeys were given overdoses of methamphetamine. But what John's failing to realize here is that meth is also an FDA-approved substance. None of the psychedelics that he's advocating for are FDA-approved yet, but meth has been, if we're using that as our indication of validity here. Meth has been approved for a long time for ADHD, and also has been used either on or off label for weight loss. But meth has also been heavily criminalized and media sensationalized in this country, and is punishable in the form of, in the eyes of the law, at the same weights as crack cocaine. So John did not need to use meth as a punchline here, and he is also he also calls MDMA a psychedelic, which, while it does have psychedelic qualities, he doesn't acknowledge that it's an amphetamine class, and he actually says that meth is a way different drug, which we know that meth and MDMA are chemically very similar drugs, actually. So John is actually way off in saying that. He doesn't acknowledge, well, he acknowledges the war on drugs in his earlier episode. In both episodes, he fails to acknowledge really its specific way of targeting minorities, but John does do a lot of acknowledging systemic forms of oppression in all of his work, so I'm not going to harp too much on that. I really want to focus more on specifically like how he could have better informed his drug knowledge here. I did not like that he didn't mention any of the inclusivity issues that exist in current psychedelic therapy research, where at least 82% of the studies from 1993 to 2017 in psychedelic research, at least 82% of the participants were non-Hispanic whites. So there's been a very significant lack of diversity in psychedelic research, and this is going to inform who gets access to therapy, which is something that he moderately draws attention to by saying that with the medicalization approach, big companies have been investing lots of money, and there's a lot of, when big companies, there's a lot of competition in the market, and a lot of big money also going on. So he doesn't quite make that clear, but he does very much address all the scare tactics that have existed, but he doesn't say how they still exist now. He just talks about the scare tactics and the fear propaganda as if it was a thing of the past, but he doesn't acknowledge how those things are still being taught. So I think it's just important to draw on where John could have grown in this episode. Like I said, there were a lot of good things in the psychedelic therapy one, but my biggest critique, honestly, I got really annoyed with the meth joke for no reason, and he just says a couple things that are ill-informed, like saying some drugs are really fun, but some can ruin your life, but like it's not the drugs themselves that are always the cause of ruining people's lives. It's like the community issues or the personal physiology at hand or the contextual situation that we know informs substance use disorder. And so John does not need to make a brunt of a joke out of heroin or meth users or monkeys participating in those studies for that reason. And so he also had a quote from a New York Times study. He didn't acknowledge MAPS at all, which I thought was really interesting. But he did quote a New York Times study which used MAPS data, the 67% improvement data that I'm sure if you're listening to this, we all have heard. If you haven't heard what I'm talking about, go back and listen to John's episode. But the New York Times article headline or title was The Next Big Addiction Treatment, which is something we'll come back to on this podcast, but I think it is slightly, I guess it's unsurprising for the New York Times to say this, but to say that it's the next big addiction treatment as if addiction is something that can be treated by the same things that we treat like right now in a medical model is just like insane. And I don't know why the New York Times like can sometimes be psychedelic exceptionalist. I guess I'm not surprised, but John's episode of psychedelic therapy also really reads psychedelic exceptionalism a lot, which is a term that we'll come back to also. But I want to get into talking about his episode from 10 months ago about harm reduction. So the focus of this episode was to discuss why overdoses have been on the rise and what we should and shouldn't do to prevent them. And he says that, this is where he says that drugs can be so much fun, but sometimes they're so much fun, they ruin your life, which is true and false, to return to this statement of John's. It's false in the way in which drugs are not what actually ruin your life or aren't often the direct root, cause and or correlation is not causation here. There's often a lot of other community and personal contextual issues that interplay with substance use disorder and ignorance and lack of access to resources in healthcare and education is often what actually ruins people's lives, not drugs. Not the drug itself. Not the drug itself cannot ruin a person's life. It's just a drug. It's morally neutral, right? But it is true in the fact that the drug underground or street market is unpredictable and unregulated and dangerous a lot of times. So in that way, it can ruin your life because when you have to buy things on the street, you don't often have a way of testing them because, as he also discusses, testing kits are illegal in a lot of states, or you have to have a reason to get them in some other states, which is just totally absurd. Narcan also faces similar restrictions, which John also discusses, where you need a prescription to get it. I myself was given a prescription of Narcan one time when I was also given a prescription for opiates before getting surgery, and my prescription for hydrocodone was $10 and my prescription for Narcan was $100. So you can guess, which one I walked out of with Kroger that day. But to come back to John's episode, really his harm reduction episode, I had a lot of praise for. I think overall though, he, does make the same fault that's inherent with the term of harm reduction, because in associating drug use with harm and methods of reducing harm, it's not actually fixing like the problems at play, which are that drugs are often used by people who are in vulnerable or compromising environments or situations, which is why they are associated with harm. And he quotes, the New York City overdose prevention centers, which are going on about, which I support and have a lot of good things to say about those sites. I think they're awesome. I've visited the one in Washington Heights before. Sam Rivera, the executive director, is amazing. But they are essentially just, ways of putting these people who are going to be doing drugs anyway in a box, because otherwise they would be doing it on the street. Whereas if we gave those people resources and opportunity for housing, or better access to jobs, or some sort of community rehabilitation program, then they would be able to do what everybody else does when you do drugs, which is in the privacy of your own bedroom. So John does not discuss this or bring to light any of these facets of the harm reduction story. But he does talk about the war on drugs. He does mention it. He does not really clearly talk about how people of color have been directly affected by the war on drugs. I think he could have addressed it more, is what I'm trying to say here. And I also need to critique him on his data for the 100,000 overdoses as reported by the CDC in the year, prior to John's reporting on this, which was, like I said, 10 months ago. So that data by the CDC, while yes, it's the CDC, I have no reason to believe that, they're not accurately reporting their information. The coroners, who are the ones writing the death certificates, those are what we need to be looking at here, because a lot of times things can be misattributed as drug overdoses when really they were something else, or there were other factors at play. And really to learn more about how coroner certifications and coroner levels of training varies widely state by state. Not all of them are medically trained in the same way or at all. And, if they're misattributing a death as an overdose, that information is then getting reported by the CDC. And then that's why we have figures that say that, drugs cause more deaths than guns, which is kind of absurd to think about. And I was kind of disappointed that John didn't do more statistical explanation, or just further data, show further data on this, because again, it's really important to talk about the how coroners have misattributed deaths. Carl Hart has talked about this extensively, so I really urge you to look into some of that research. But there is a lack of consistency with how overdoses are labeled on death certificates, and how coroners are trained, and what kind of testing is done on people that have died. And so John would do well to address that. But again, I have a lot of good things to say about that episode. I really liked also that he brought to light that fentanyl, touching really any drugs that we like to criminalize in this country, cannot kill you upon exposure. And he really addresses how the police and the media outlets have repeatedly spread this story, which is not factual at all, because even if a cop or anybody had touched or been exposed to touching fentanyl, it's scientifically and medically impossible for you to have a reaction just from touching it. So I'm really glad that John brought that to light, because especially if you're a healthcare worker or student out here that's listening to this, touching fentanyl cannot kill you. But roses are still red and cops still wear blue. So thank you for listening to this episode. I'll try to write in any comments if there's anything I missed. But let me know what you think about John's episodes, and maybe you'll see this. And thanks for listening. Until next time, thanks for listening to this episode of Drug Advocacy Resource Education.